Turning 65 is a significant milestone, and enrolling in Medicare is such an important decision that you need to be informed about. This is so important because if you miss certain steps, you could face lifelong penalties, gaps in coverage, and mistakes that could have been avoided. So many people are misguided because they've trusted biased information that wasn't accurate. This is very easy to avoid because having the right information, unbiased information, will lead you to making the right decision. I've seen so many clients come to me in a panic because they've made a poor decision. Sometimes these can be fixed. Other times these mistakes are irreversible and will last a lifetime. Trust me, you do not want to be in that position. If you don't know me yet, my name is Jane Petrie. I've been a Medicare advisor for over 15 years, helping hundreds of clients navigate the complexity of the Medicare program. My mission is to give clients unbiased information, leading them to peace of mind, the healthcare coverage that they need, and financial security. In this video, I'm going to go over the top 5 things that you must know before you turn 65. By the end of this video, you will feel confident in making the decision for your Medicare needs and take control of your Medicare decision. So let's get started. The first part are what are the parts of Medicare? The first part is Medicare Part A. This is the coverage for inpatient hospital care, which includes skilled nursing facilities, hospice care, and some home health care. It's the room and board only in these facilities. Most people don't have to pay a Medicare Part A premium. If you or your spouse have worked 10 or more years and paid into the Medicare taxes, there is no monthly premium. The second part of Medicare is Medicare Part B. This is the busy side of Medicare. It includes all your doctor's visits, outpatient services, surgeries, emergency room, preventative services, MRIs, CAT scans, laboratory work, etc. It's again the busy side of Medicare. There is a monthly premium that everybody pays for Medicare Part B. Then there's Medicare Part D. This is your prescription drug coverage. It's provided by private insurance companies that are approved by Medicare. The plans, which there are 14 this year, vary in coverage and cost. The last part is Part C, also referred to as Medicare Advantage. This is also referred to as Medicare Complete or Medicare Replacement. This is an alternative to Original Medicare, which includes Part A, B, and D. These plans are managed and run by private insurance companies that are approved by Medicare. Again, it includes, all included, that's why it's called Medicare Complete or Medicare Replacement, because it includes or replaces Medicare's Part A, B, and D. These plans also are the plans that offer additional enticing extras. They offer some vision, some dental, some hearing, the big one, the free gym membership. Medicare Advantage plans are heavily marketed. You're going to see a lot of advertisements for the Medicare Advantage plans. So it's really important as we go further in the video to understand what exactly is the Medicare Advantage plan that replaces, again, Original Medicare Part A, B, and D. The second point that's really important is the eligibility, Medicare's eligibility requirements. So the first is the age. Generally, you must be turning 65 or disabled or have certain medical conditions to qualify to enroll in the Medicare program. So disability, people that are under age 65 that have been on Social Security disability benefits qualify after 2 years to enroll in the Medicare program. Certain medical conditions allow you to enroll into Medicare before age 65. These include end-stage renal disease requiring dialysis and also ALS. If you have one of these disabilities, you're entitled to enroll in Medicare at any age. The third point is Medicare cost and what they mean. So for Medicare cost, there is a premium, the monthly amount paid to Medicare or an insurance company to maintain coverage. So the first is Medicare Part A premium. Most people don't pay a Part A premium. If you or your spouse have worked 10 or more years, there is no monthly premium for Part A. Part B premium. There's a standard premium that everybody pays for Part B, and that this year in 2025 is $185. People with a higher income are required to pay more for Part B. The last is Part D, prescription drug coverage. The monthly premium for Part D ranges from $0, free, up to over $100 per month. And these plans are based on your specific medications. Again, people with higher income are going to pay more than the standard rate of $0 to $100 for their Medicare Part D premiums. The next point is, what is a deductible? This is the amount that you must pay before the Medicare plan begins to pay on your behalf. So the next point is coinsurance. What is a coinsurance? This is a percentage of the cost of service that you will pay after meeting your deductibles. Typically, in Medicare, Medicare pays 80% and the coinsurance is 20%. The next is copayments. This is a fixed amount that you will pay for a covered service. For example, you'll have a copay for prescription drugs, a copay for your doctor, your specialist. So a copay are small fees that are paid for these type of services. The last is out-of-pocket maximum. An out-of-pocket maximum is the amount that you could have to pay for covered services in a year. Original Medicare doesn't have any maximum out-of-pocket, but the Medicare Advantage plans do. So for Medicare Advantage plans, after you spend this amount, the maximum out-of-pocket, which includes your copays, deductibles, then the plan starts to cover 100%. But in Medicare Advantage plans, they pay 100% as long as you're in network. Point number 4 are the enrollment periods. This is really important to understand your enrollment period. The first and most applicable enrollment period for people turning 65 is the initial enrollment period. The initial enrollment period, referred to as the IEP, initial enrollment period. This starts 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. It's a 7-month period. During the initial enrollment period, this is when people turning 65 generally enroll for the first time in the Medicare program. So the next is the special enrollment period. These are times outside the regular initial enrollment period when you can enroll or change your plan under certain circumstances, like you've retired, you're leaving credible coverage and you need to enroll in Medicare, or you're moving out of state and your plan is no longer offered in the state in which you're moving. The next is special enrollment period. These are times outside of the initial enrollment period when you can enroll or change your plan under certain circumstances. For example, a life-changing event like retirement, or leaving credible coverage through an employer, or moving out of state and your plan isn't offered in the state where you're moving. Then there's general enrollment period. This is typically for people that have missed their initial enrollment period or where the special enrollment period doesn't apply. This period begins January 1st and ends on March 31st of every year. The coverage will begin the month after you've enrolled. So if you enroll in January, during the general enrollment period, your coverage will start February 1st, and so on. And the last enrollment period that occurs every year is annual open enrollment. This is a very important time because from October 15th to December 7th, every year, you can change your plans. You can change your Medicare coverage, you can switch from original Medicare to a Medicare Advantage plan, or you may be able to switch from a Medicare Advantage plan back to original Medicare. However, in order to do that, in order to go from Medicare Advantage back to original Medicare and get a Medigap plan, you must go through medical underwriting, and that requires that you are healthy. And the last thing during open enrollment that you should review is your Part D prescription drug plan. You can change your drug plan with no medical underwriting every year. It's critical to do this because the plans can change from year to year. The last point are, what are your coverage options? So the first option is to stay with original Medicare. To remind you that everybody starts with original Medicare. Original Medicare again includes Part A, the hospital coverage, room and board only, covers Part B, doctor, outpatient services, etc., and Part D, your prescription drug plan. People that choose original Medicare have an option to add on a Medicare supplement or a Medigap plan. These plans cover some or all of the gaps in coverage, for example, the copays and deductibles under original Medicare. With original Medicare, one thing that I like the most is that there are no networks. You can go to any doctor, any hospital, anywhere in the United States or its territory. You call a doctor's office or a hospital and you say, I have original Medicare and a Medicare supplement. It's like the red carpet is rolled out for you and they're ready to make you your appointment. The Medigap policies or Medicare supplemental policies that you have an option to add on to your original Medicare are standardized by the federal government. They're meant to fit like a puzzle piece with original Medicare. So when Medicare pays their percentage and there's a gap, the Medicare supplemental plan comes in like a puzzle piece and covers that gap. The second and only other option is Medicare Advantage plan, as referred to as Part C, also referred to as Medicare Replacement or Medicare Complete. These plans are offered by private insurance companies. They are a replacement to original Medicare. You no longer have Medicare through the federal government, but through a private insurance company. And that private insurance company begins to manage your care. On the plus side, these plans offer other additional benefits that original Medicare doesn't, like some dental, vision, hearing. However, they do offer these additional benefits, but they do require that you use a specific network. Typically, they're state-specific, and they also have a high rate of prior authorizations required, and oftentimes they have a high rate of the prior authorizations being denied, so you can't receive the service that your doctor has ordered. Lastly, Medicare Advantage plans are typically marketed as free, but they're not free, and here's how. They all have annual out-of-pocket maximum amounts. These are amounts that you will have to pay if you're receiving services. So they're marketed as free, but beware, you have an annual out-of-pocket maximum that could exceed $4,900 in a year. Let's face it, if you're in the hospital receiving care, it would not be unlikely that you'd have a $4,900 up to $10,000 bill for that hospital stay. So those are the top 5 things that I think you need to know before you turn 65 and make your initial decision of your Medicare coverage. These are so important because then you'll have the knowledge to make a confident decision in what coverage is going to best suit your needs, not your friends, not your neighbors, but what's best for you, and what plan is going to be the best for your future healthcare needs. There's so much information out there. Some of it is helpful, some of it's good, some of it's really bad. You can do all the research you'd like, but my advice to you is find someone that's going to be your Medicare advisor, that's going to give you specific advice to your personal needs. Sit down with you, ask you questions, listen to your needs, and guide you to making the right decision. I provide this type of services to all of my clients. I love the fact that we sit down, have a one-on-one meeting, and I listen to their needs. That's the first most important thing, is hearing what each client's individual needs are. I want my clients to have confidence, have peace of mind. I'm looking out to make sure that they meet their healthcare needs for today, tomorrow, and into the future. And most importantly, that the plan fits within their budget. And looking out for their financial stability, long term, is the plan going to be affordable? And finding, with all of this information, what is best for each individual client. It's not a one-size-fits-all. Everybody's needs are different. My goal is to find what suits your needs, gives you the greatest peace of mind and confidence for today and into the future. So, if you're enrolling in Medicare for the first time or already enrolled in Medicare and looking to make a change, please contact me. This is what I do. Every day, day in and day out, I help people understand their options, save money, and get the most optimal plan for their Medicare needs. And I'd love to do the same thing for you. You can book a free consultation by emailing me directly or visiting my website. Thank you for watching. I hope you found this helpful. If you need help, please feel free to contact me, and I hope to hear from you soon.